Hello, my name is Dr. Sarah Wesh. I am a licensed psychologist. I practice here in Manhattan, Kansas, and my specialty is perinatal issues. Everything from obviously postpartum depression, anxiety, psychosis, to infertility, to miscarriage, stillbirth. These are all the things that my practice is focused in on. And today I want to talk to you about understanding perinatal psychiatric crisis, and particularly how, as a community, we can help families and prevent worst case scenario outcomes. What do we mean by perinatal psychiatric crisis? I think everyone's aware that the postpartum period is a high risk period in terms of mental health for women. But I think when we think about it, most of us think about moms being sad or maybe a little detached from their baby, maybe more anxious than normal. Most people don't really think about the really severe psychiatric crisis that can occur during this period. Particularly, postpartum psychosis is a really dangerous and very quick to evolve situation that can put both mom and baby at risk. Postpartum depression can move well beyond just sadness or emptiness or poor bonding with the baby. It can get very severe. And then another condition, postpartum OCD, is also quite distressing and difficult for mothers, but it's also important not to confuse it with the other issues. Sometimes moms have been seeking help for some of these issues and getting issues with social services that need to be avoided. We'll talk more about that later on. How common are psychiatric issues in the perinatal period? 85% of new mothers will have at least the baby blues. And by the baby blues, we mean sort of transient, the first month or so postpartum, feeling weepy or sad or keyed up and anxious, right? But for most new mothers, that will begin to pass as hormones level out and sleep starts to get a little bit better. But for 1 in 5 new mothers, we're actually going to see a diagnosable psychiatric condition. 1 in 5, 20% of new mothers, that's more than, gestational diabetes, that's more than a hemorrhage at the time of labor and delivery. Psychiatric condition is the most common adverse outcome of pregnancy, right? What causes this? I will say the number one factor is sleep deprivation. Sleep deprivation for new mothers can occur even starting with labor and delivery. For people who have a labor and delivery that spans a couple days, that amount of sleep deprivation can sometimes trigger some of the very worst psychiatric crisis that we can experience, postpartum psychosis. Also, these issues can cause insomnia, right? So whether it be postpartum psychosis or depression or OCD, insomnia can be a component of those issues. And it's both sort of a symptom and a cause of worsening symptoms. Hormonal shifts are a big factor. Obviously, we have the shift that happens, going from pregnancy to postpartum, but we also have the shifts associated with breastfeeding. In terms of genetic factors, obviously a family history of any mental health issue is a contributing factor, but particularly when we see bipolar disorder, that is an issue that is a risk factor for both postpartum depression, but also postpartum psychosis. Obviously, the postpartum period is a period of rapidly expanding new responsibilities, and the stress of that can weigh on both new fathers and new mothers, right? 1 in 10 new parents, new fathers, will actually have a mental health condition as well as a result of all of these new stressors and changes. In terms of personality factors, the biggest personality risk is perfectionism. So if you have a new mother who has a tendency to be a little more type A, to really be hard or critical with herself, that can particularly be a risk factor for postpartum depression and postpartum anxiety disorders. Relationship conflict, and particularly an abusive relationship, is a risk factor. Social isolation. I see this a lot in my Fort Riley families. We've got these really younger moms. They may be really far away from home. Husband may be deployed. It's kind of a recipe for postpartum depression, really, And I think nowadays, with more social media and less in-person interacting, I think social isolation is worse than ever. Okay. Birth trauma, both in terms of physical birth trauma. So we're just talking about like damage to the body that's sort of beyond what is expected. So if you have, third or fourth degree tearing during the birth, but also the emotional trauma of birth. So if mom feels like her own life is at risk, or if she's told the baby might die if she doesn't have that C-section or something, any kind of emotional or physical trauma during the birth can be a risk factor. The final risk factor that I can think of is the baby's temperament or health. Obviously, a very colicky baby who's up every 90 minutes just wailing, that's a contributing factor for postpartum issues. But also being in the NICU or just having a lot of complicated health conditions, those are all factors that can contribute to perinatal mood and anxiety. When are mothers at the most risk? In terms of postpartum psychosis, that can happen immediately postpartum. Again, the sleep deprivation of labor and delivery can sometimes throw moms into a manic episode, which then leads them into a psychotic episode. However, postpartum psychosis doesn't only happen in immediately postpartum. It can happen after kind of months of sleep deprivation, or it can even happen at weaning. Right? In terms of postpartum depression and suicide in new mothers, 9 to 12 months is the period that we see the most suicide in new mothers. And weaning from breastfeeding, again, as I mentioned, can be a time that can trigger any of the postpartum mood and anxiety disorders. What is postpartum psychosis? Right? The early stage of postpartum psychosis and the most common manifestation of it is mania, right? So what we will have is sleeplessness without fatigue. So again, insomnia can be part of postpartum depression. It can be part of postpartum anxiety. But when we think about sleeplessness without feeling tired, that's more of mania, right? So we might have sleeplessness without being tired, accompanied by hyperactivity, racing thoughts, rapid speech, right? Mood-wise, it's hard to say. It could be a little anxious, obsessive, irritable. Could also be a little euphoric. And so it's kind of hard to say where mom will be at in that early stage. After a bit of the mania, then it can transition into psychosis. And that's when we start seeing mothers have very odd thoughts. You may not know that because she may keep her thoughts to herself, but she may start to have some really odd delusional thoughts, like the neighbors want to steal the baby, or the government is trying to control us. Hallucinations can occur. While mom's watching TV, she might see the images on the TV just leaving the screen, right? The world might feel kind of dreamlike, and mom might kind of go around with kind of a bit of a flat affect or an emotional look on her face. One of the things about psychosis that I think is most noticeable is people making connections that don't connect, right? Someone might start to go around and they notice groups of people talking to each other. And all of a sudden they're like, oh, those people are talking to each other because they're all planning to take me and have me join this cult, right? So again, they're seeing things, they're starting to make connections, but those connections don't really connect in real life, right? In terms of mood during this psychosis, it could be paranoid or suspicious. You could be euphoric and feel close to God. There is a woman that actually made a stage show about her experience with postpartum psychosis. It's called Playing Monopoly with God. And during her period of psychosis, she felt like the whole world was made out of love. And she felt really close to God and close to the universe, right? So again, it's not just a negative emotional state that could happen in psychosis, it could be positive. Another mood state that's possible is overconfidence, like I could do anything. Or the mom might feel really anxious and confused, right? Mothers may or may not be aware that there's anything unusual about what's going on for them, but their family and partners will begin to notice that something very strange is going on, right? In that case of the woman earlier with playing Monopoly with God who did the stage show, she believed the world was made out of love, and her husband was starting to think, seems a little strange, she's not quite herself. But the turning point moment in their relationship was when she said to her husband, I'll prove it to you. The world is made out of love. Just take our baby and throw her through this brick wall. And if you believe it's made out of love, she'll fly right through it. And her husband was like, no. And we're going to the doctor, right? To this day, that mother is still really shook up by that moment that had she been holding the baby, that whole incident could have turned out quite differently. But fortunately, her husband was holding the baby. She was able to get the help she needed, and then she went on to do this really cool stage show about her experience to educate other people. One thing that's important to note is that symptoms can come and go. Unlike with schizophrenia, which we might see a more consistent pattern, in postpartum psychosis, we might have psychosis 1 minute and then it might have a break, right? And she might seem really reasonable at one moment and not in other times at all. Some myths about postpartum psychosis. One myth might be that it only happens to people with pre-existing severe mental illness. It can happen to anyone, though it is more common in families with bipolar. It can happen to anyone. One of the very first women that I treated for postpartum psychosis was just like girl next door. Had never even had an episode of depression or anxiety before. This was the first time she'd ever had a mental health concern, and she ended up 2 weeks inpatient in the hospital trying to get this treated. The second myth is that postpartum psychosis is extremely rare. I mean, it is rare, but 1 out of 750 mothers, that's actually pretty common as well. When you think about Manhattan, Kansas, just Manhattan, Kansas, in our hospital, not the surrounding areas, we have about 1,000 babies born a year. Right? So we're looking at, 1 or 2 mothers in our area per year. Another myth is once someone has psychosis, it never goes away. Again, postpartum psychosis is different than chronic mental illness like schizophrenia. Postpartum psychosis is a very temporary, treatable condition, and it may be the only time in a woman's life that she experiences that kind of mental health condition at all, right? The last myth is mothers with postpartum psychosis are a risk to their children because they don't love them, right? It's like, and the fact is that most mothers with postpartum psychosis who end up harming their babies or children do so out of a mistaken belief that they are saving or protecting the children from some greater harm. We're going to talk more about that. In terms of the risks of postpartum psychosis, we are at a 1 in 20, right, risk, a 5% risk of losing mothers to suicide, and a 1 in 25 risk of losing infants. So again, out of that 1 out of 750 moms, 1 out of 25 of those 750 will go on to harm one of their children or to harm themselves. We're talking about this worst case scenario, killing a child, right? Killing an infant. Dr. Susan Hatters-Friedman of Case Western University breaks down sort of the reasons why parents take the lives of their children into 5 categories. Obviously, the most dangerous day in a baby's life in terms of homicide is the very first day they're alive, because one of the most common ways that a baby can die is a mother who disposes of her baby on the day that the baby is born. And this could be like a teen mother who is in denial about being pregnant. I think we've all heard about, I think there was a mother once who gave birth at prom and put her baby in the trash can and then went right back out onto the dance floor. Right? We created safe haven laws so to help reduce the incidence of this kind of situation. So mothers hopefully know that they can drop their baby off at a police station or a fire department or the hospital with no consequences if they want to give up their baby. The second category is children and infants who die out of just abuse or neglect. And this can be in a household where the parents aren't very healthy, maybe they are drug addicts, and they shake or harm their baby in some way. The third category is a partner seeking revenge, right? So a couple's getting a divorce And one of the partners says, if I can't have these children and this partner, no one will, right? It's the fourth and the fifth condition that we're going to talk more about today, and that mental illness, so depression or psychosis with an altruistic motivation, is the fourth one. This is the idea that the mother is in a fit of mental illness, actually killing her child out of some desire to save the child from some worse harm, right? So they may feel that, again, in the case of depression, that I should never have had this child. The world is actually a terrible place. I don't want this child to suffer. And so I'm going to take the child's life, then take my own life, right? The other idea could be something along the lines of, in my psychotic state of mind, I think this child is doomed to go to hell. And if I kill this child now, then they won't go to hell. Right? So again, I'm trying to save the child from an eternity of torture, and I'm going to do something horrible now, but in the baby's best interest. The fifth category is more of psychosis with a delusion about their child. So like the child is evil, or God wants her to kill the child, or I hear a voice that tells me to kill the child. In terms of infanticide law, since for over 100 years, England or the UK has had laws that protect new mothers who commit crimes like this in infanticide in the first year postpartum. There's probably around 12 countries in the world who have those kind of laws that acknowledge that the perinatal period is a time that can cause homicidal behavior in new mothers due to mental illness. The U.S. does not have these laws. I think some states have been considering them, but in some cases an insanity defense has successfully been used for mothers who are in a state of psychosis or severe depression at the time of the infanticide. The most famous case, at least of in my generation, of infanticide with psychosis is Andrea Yates. So this was over 20 years ago now. Andrea was left alone. She probably should not have been left alone, but her husband was trying to kind of get her used to being on her own again, even though the doctors had said never leave her alone. And she ran a bath and systematically, one by one, drowned all 5 of her children. And then she called the police and reported herself. Andrea was arrested and convicted of murder in 2001, but 5 years later, that was overturned, and she was given she was found not guilty for reason of insanity. I believe she's still in a mental hospital to this day. Obviously, even if you're able to get the treatment you need, I don't know that any mother is ever going to be able to recover from doing something like that. Recent case, this was this is February 2023 that I'm recording this right now. This was just last month. Lindsay Clancy, she was a nurse midwife in Massachusetts. She worked at Boston Medical Center. 3 lovely children. She had not been doing well with postpartum mental health, and one evening sent her husband out to get a prescription filled and to get dinner, and while he was gone, she wrapped cords around all 3 of the kids' necks, and then tried to slit her own wrists, and then jumped out the window instead. She, from what I hear, will not be able to walk again. All 3 children perished, and we're still kind of waiting for more details on just exactly what type of mental health condition Lindsay was experiencing. But again, lots of people have written in to talk about what a loving mother she was, what a good and trained midwife she was. She would have known about postpartum mental health issues, but even if you have that professional knowledge, that doesn't mean you can stop the effect of it on your family, right? Just a really sad, tragic situation. Last fall, in November, another mother, Damone Fleming, this is another case, she one night killed both of her children. And I was looking at this case, there's not nearly as much information about what kind of defense this mother might be getting and whether or not they're going to be able to try to use the insanity defense for this mother. A couple articles I read said that she had started to become very religious after the birth of her children, which again, there's a lot of research that says that going to church is really good for your mental health, but sometimes excessive religiosity can be a sign of psychotic disorders. And she believed her children were demons. So again, this would be sort of that fifth category of infanticide where she thought maybe the children were possessed. I concerned that this mom, because she was living in public housing, because she's a person of color, that she may not be getting the kind of recognition or defense that Lindsay Clancy has been getting in terms of having a lot of sympathy, a lot of concern that she might have had a mental health issue. I found an article about Damone about her being a fugitive in a child porn case, which again, sometimes we see this with lower income people when they have been in the news, that any crimes in the past that they've committed will come up. But the truth is about this child porn case is that when she was 18, she was dating a 15-year-old who sent her nudes, and when they broke up, being a little immature and 18, Damone sent those nudes to her boyfriend's mom, and that's how she was convicted of child porn. So again, this is a mother who may very well have had postpartum psychosis, and she did, worst case scenario occurred, she did kill her 2 children, but I'm not seeing anything in the news about her receiving the kind of support that Lindsay Clancy has been getting, or about any of the kind of legal defense that Lindsay Clancy will be getting as well. Switching gears, talking a little bit about postpartum depression. In terms of postpartum depression, the emotional state that we're really looking at is not so much sadness and tearfulness, though that can definitely occur, but just a real, what we call anhedonia, the inability to enjoy life. Like, I used to like this show, but I don't enjoy this anymore. I used to like this food, but I don't enjoy it anymore. Numbness, sadness, loneliness, a sense of being ashamed or guilty, right? With severe postpartum depression, we're going to see a loss of appetite. In more mild cases, we might see an increased appetite. And again, in the postpartum period, it's normal to have increased appetite due to breastfeeding or just, recovering from childbirth. When we see that loss of appetite, we see that as a sign of more significant concern. In terms of sleep, we may see a mom who struggles to fall asleep or to stay asleep, and then may end up compensating by that for sleeping more in the daytime. We should see, again, moms in the postpartum period should be very tired, right? But they should be able to be awake when the baby's awake, and they should be able to fall asleep when the baby is asleep, right? And if we see some disruption in that, we know that we have something going on. In terms of cognition, in terms of thoughts, we'll see something along the lines of, I'm a bad mother, or this baby would be better off with a better mother. That's a really particular concern in terms of a mom's risk for suicide. If she feels that she's a burden to her family, if she feels like the baby would be better off with a better mother, we need to really take that very seriously. In terms of behavior, we may see moms avoiding friends, we may see a reduction in hygiene, and of course in new mothers sometimes we do see a reduction in hygiene because it's hard to take a shower while you're caring for a baby. But this is sort of, again, I'm not brushing my teeth, I'm just not taking care of myself the way I normally would. Staying indoors or in bed much of the time, and tearfulness. In terms of suicide in the perinatal period, there's some evidence that it could be on the rise. So in 2006, we were looking at a 2 out of 1,000 suicide rate in new mothers. And think about that, that is not a small number. But in 2017, we're looking at more like 6 out of 1,000, right? So we're getting up towards close to 1%, right? The most common time period, as we mentioned earlier, is 9 to 12 months postpartum. Coincidentally, that is also the time that I am most likely to see a mother for postpartum depression or anxiety, is around 8 to 9 months postpartum. I think people try to say, okay, it'll get better, it'll get better, it'll get better. And by about 8 or 9 months, they're like, this is not getting better. So again, that's the time when I see most clients coming in. The majority of mothers who complete suicide are not in treatment. What we know is that treatment for postpartum depression is actually quite helpful inefficient. And so again, most of the mothers we lose to suicide are ones who aren't connected with treatment. The strongest predictors, again, are feeling like a burden, feeling like the partner baby would be better off without her. If you're in a position of interacting with a mother who's having suicidal thoughts, again, you want to ask her if she'd feel better, if she thinks that her husband or baby would be better off without her. But you'd also want to ask her, do you have a plan for the baby? Because most new mothers who are having suicidal thoughts will say, the baby's the reason I won't do it, right? But if the mother responds, the baby will be better off without me, or even worse, if she says, I was thinking of taking the baby with me, right? Obviously, that is the one we really have to be concerned about. We want to help mothers who are having suicidal thoughts, but some mothers with suicidal thoughts will actually be thinking as well about taking the baby with them, right? Again, mothers have a hard time thinking about abandoning their children. So mothers who are having suicidal thoughts sometimes thinks about taking the baby with her. Postpartum OCD. Okay, so again, postpartum OCD is different than OCD outside of the postpartum period, though mothers who have OCD or OCD-like tendencies, of course, are more at risk. Mothers with postpartum OCD will be anxious and keyed up. They may have lost some of their appetite, and they may have trouble falling asleep or staying asleep due to worries about the baby. The hallmark of postpartum OCD is having intrusive thinking, unwanted, upsetting thoughts involving the baby. An intrusive thought is sort of like a visual worry. And most new parents have these. I would say about 95% of new parents have some intrusive thinking. The, real common one is, you're standing at the top of the staircase and you can just almost see yourself falling down the stairs with the baby or dropping the baby. For most new parents, they're able to just kind of say, oh, that was a weird thought and I just won't do that. And they just sort of brush it off. But for parents with postpartum OCD, these intrusive thoughts are frequent, and they will start to develop sort of fears around those thoughts, like, oh my gosh, I'm thinking about the baby coming to harm. Do I want to harm the baby? Am I, again, she may fear she has postpartum psychosis. She's heard about Andrea Yates. She heard about Lindsay Clancy. Maybe I'm one of those mothers who's going to end up hurting my baby. So the mother actually may be afraid of being alone with the baby, or afraid of letting anyone else care for the baby. In terms of intrusive thoughts, some of the most common triggers are things like knives. I remember I was one of the very first people I ever treated when I was in grad school, so this is over 20 years ago, was a new mother, and she was chopping carrots one day and just saw herself chopping the baby instead. And of course she was horrified by this thought and thought, what does this mean about me? What is wrong with me? Again, nothing is wrong with a mother who has that kind of thought. It's simply the brain's way of saying, be careful, don't do that, right? But having a thought like that can really shake a mother up, like something is wrong with me. Bathtubs are a very common trigger, again, imagining the baby sliding under the water. Staircases, again, another really common trigger. An open window. A lot of mothers will just imagine themselves throwing the baby out the window. And that same thing could be said for standing on the edge of the Grand Canyon, or any kind of height will elicit, again, this intrusive thought of like, what if the baby went flying out of my arms? The last image there, the crib. I would say this is probably one of the more common ones, where parents will imagine their baby passing from SIDS and have this almost visual image of their baby, blue-lipped and not breathing, laying in their crib. So talking a little bit about one of the reasons why I'm talking about postpartum OCD is that we want to talk about how to not overreact to intrusive thinking, okay? Because intrusive thinking is not a risk factor for harming babies, right? And so here's an example of an overreaction. This came from September 2019, Hayden and Hudson Graham. Hayden was experiencing some postpartum depression. She admitted to having an intrusive thought about killing the baby. But when she had that thought, she was like, oh my gosh, that's a terrible thought. Something must be wrong with me. I probably need some mental health help. So she went in to go get some mental health help, and the couple lost custody of their children for more than 2 months. Okay, so they end up having to spend thousands of dollars on psychiatric evaluations and legal fees to get their family back together again, right? So again, while we want to be really aware of the risk to children that can occur in postpartum psychosis and postpartum depression, we definitely don't want to confuse intrusive thinking for homicidal intent, right? Again, when a woman has an intrusive thought, her reaction is, oh, that's horrifying, right? And a woman who has that kind of horrified reaction to that thought is not someone who's going to do harm to her child, right? Again, that's just intrusive thinking that 95% of new parents will have at least some of. And we have to make sure, especially as professionals and first responders and everyone involved, that we're not confounding those two. And of course, as first responders, you are not responsible for diagnosis, but being able to find the people who do know how to do the diagnosis, it's important, certainly before anyone's children are taken from them. In terms of differential diagnosis, again, not your responsibility, but let's just review this a bit ourselves. There is some overlap between postpartum psychosis, PPD, postpartum depression, and OCD. There's overlap between the three of these. All three disorders may have insomnia. They all may have irritability. They all may have anxiety. Sadness, tearfulness can occur with any of these. Trouble concentrating will definitely occur with all of these. So again, those are those core factors that are at the center of the overlap of these Venn diagrams. But with postpartum psychosis, we're going to have insomnia without fatigue, right? Hyperactivity. We're not going to see euphoria really with either of these other two conditions, nor will we see paranoia, suspiciousness, difficulty communicating, odd beliefs, or hallucinations. That's all postpartum psychosis and nothing else. In terms of OCD, intense intrusive thinking, a strong reaction to these intrusive thoughts, right? You might have fears of having postpartum psychosis, fears of doing harm to the baby, again, but not fantasies of doing harm to the baby. And again, it can be hard to tease those things out, right? And that's why it's really important that you get a new mother that you're concerned about to a professional that has that kind of training, such as myself, right? They may fear being alone with the baby. With postpartum depression, we might see some insomnia, but we're also more likely to see oversleeping, hypersomnia, guilt and shame, suicidal thoughts of running away from the baby, and definitely that really concerning thought, the baby deserves a better mother. Again, just another way of kind of pulling these things apart in terms of sleep. With OCD, anxiety may be a trigger for insomnia, but there'll definitely be a missing of the sleep. I'm exhausted. I'm distressed by the fact that I can't sleep. In postpartum depression, we may have insomnia or hypersomnia or both, right? With postpartum psychosis, we're most likely to have insomnia with hyperactivity and without much fatigue. Again, I'm awake, I'm folding outfits all night long, or I cleaned all the baseboards all night long. Again, new mothers shouldn't have that much energy, right? And if a new mother that you know is having an extremely big shift in the amount of energy she has, just really keep a very close eye on that. In terms of distress, mothers with OCD will be very distressed and very concerned that something is wrong with them, right? Mothers with postpartum depression may feel very shamed and guilty and hopeless, right? And mothers with postpartum psychosis may or may not feel like there's anything wrong, right? They may, but if they are far enough into psychosis, they may just not realize, right? In terms of thoughts, with OCD, we'll have intrusive thoughts with worry about self and safety, right? With postpartum depression, we're going to have thoughts that are guilty and self-critical. And with postpartum psychosis, the thoughts may be paranoid or odd, grandiose, or religious, right? The most important thing is this bottom row here, risk to baby and mother. Postpartum OCD poses no risk, right? No risk. And it's really important that if you have a mother who says, I had this really upsetting thought about shooting the baby or chopping the baby up or dropping the baby down the stairs, that mother, if she thinks those thoughts and then thinks, oh my God, it was horrible and something's wrong with me, that sounds like postpartum OCD to me, and that does not sound like a mother who's planning on doing anything harmful to a baby. with postpartum depression, there's a real risk of maternal suicide. There is also a smaller risk of infanticide in a case of a mother who does not want to leave her baby in the world alone, right? And the highest risk category is postpartum psychosis, right? We are at a 1 in 20 risk of losing the baby, 1 in 25 1 in 20 risk of losing the mother, and 1 in 25 risk of losing the baby, or even also the older children, right? So again, postpartum psychosis, extremely serious condition, one that I hope by watching this presentation today, you have a little bit idea of how to begin to recognize it. Again, it's not your responsibility to diagnose, but just so that you know, in terms of what the resources are in our community. I am here. I am certified in perinatal mental health. You can contact me, consult with me at any point. I am only in network with Blue Cross and TRICARE, but I am always willing to consult if you think there might be postpartum psychosis or some, severe postpartum issue that is putting a mother in our community at risk, right? Another resource for you is a new database that I helped create. It's called mhkmentalhealth.org. And I don't know if you can really see this very well, but there are different categories that you can select for. So you can select psychotherapy, immediate availability, you can put in their insurance, you can put in their symptoms, their age, you can look at the type of treatment approach you want, the services provided, when the patient is available for therapy. You can look at the provider's race, whether or not you want someone who has specialty in issues like being culturally competent or competent with LGBTQ populations. And so again, you can put in all of this and you will get out of here a list of therapists who will be available for the client that you're working with. And so I think this is a really important thing for everyone in our community to know about. mhkmentalhealth.org. It's a really useful tool to be able to help everyone, not just new mothers and new fathers, but everyone in our community. If you have any questions, you're welcome to get in touch with me. My website is drsarahwesh.com, and you can find me that way and contact me through my website. Again, I am here, especially in the cases of perinatal psychiatric crisis, to consult with RCPD or any other groups here in town to really make sure that everyone is getting the support they need to help parents so that we can keep families safe and we can help mothers who really need to work through some of the most difficult challenges of their lives. Okay? Take care.